Shortness of breath, the surprising gut connection. If you find yourself suddenly having air hunger, you're short of breath, you just can't breathe, you're huffing and puffing and you're not doing anything, it's scary. So likely you run to the doctor or you run to the ER, and when they tell you you're perfectly fine and your lungs are fine, maybe they'll tell you you're just having a panic attack. What do you do then? So you probably get it checked out again, and maybe you see a cardiologist because you were short of breath. But all of these visits come out with the good news that everything is fine, but the bad news of that's nice, but why do I continue having this? Because when you think about it, we don't live very long without air. So of course, with the shortness of breath tends to come anxiety and a bit of panic because you just can't freely breathe and you don't know why. So in this video, I go into exactly why, explaining the gut connection. And the fact is that treating this is a natural approach, works very, very well, and it's not in your head. It is connected to your gut, and I think you'll be fascinated at the connection. Enjoy the video. Have you experienced being short of breath? Some people call it air hunger. Some people say they're just breathless. But it's a different situation because if you think about it, well, you don't think about breathing. Similarly, you don't think about your heart beating. Unless you're exercising very hard, then of course you're huffing and puffing and you have attention on getting air into your body. But generally speaking, when we're just sort of going about our day-to-day activities, we don't have to tell our lungs to breathe, we don't have to tell our heart to beat, it just happens and it's automatic. And of course, for that reason, we take it for granted. But have you ever awoken in the middle of the night, short of breath, and you're gasping and you're trying to get air in and you're breathing through your upper part of your chest because you're having difficulty. Maybe also with that you had heart palpitations. Maybe you ran to the ER to make sure you weren't having a heart attack, which is of course a smart thing to do because heart disease is our #1 killer. But maybe your heart was checked out and your lungs were checked out and you were told you're fine, but you don't feel fine because you're having trouble breathing. We'll leave the heart palpitations for another discussion. Today I'm just focusing on shortness of breath, breathlessness, feeling like you can't easily get a deep breath and you're sort of struggling with that. It's compounded if you've ever been in an ER and you've told a nurse or doctor, I can't breathe, and their response is, well, you're talking so clearly, you're breathing. A little annoying, not to mention not very sympathetic. Because yes, clearly you're breathing, but what you're trying to say is it's not normal. I know my body and I'm having trouble breathing. That's what you're trying to say, and you're getting this sort of flippant response. So I get upset with that because I hear it a lot from patients, and then they feel like they're making it up. And of course they're not, because again, they know their body. Another thing that's confusing is that in the ER or in your doctor's office, they can check your blood oxygen level and tell you, you're fine, your blood oxygen is fine, you're clearly getting enough oxygen. Again, a little confusing because what you need to know is that your body keeps the blood oxygen level within a very narrow range, because if it gets out of that range, it gets life-threatening. So the body will do a lot to keep that stable. But again, what you're experiencing is lack of proper movement of a part of your body called your diaphragm, such that you're effortlessly getting enough air. That's different than your blood oxygen level. Similarly, maybe you went to a pulmonologist, a lung doctor, and they check out your lungs and they're like, your lungs are perfect. And you start thinking, what the heck is wrong with me? And often when you're breathless like that, you're told, you're just having a panic attack, you're fine. Just try to handle your anxiety. Again, annoying, especially if you're not an anxious person. If you don't feel like life is very anxiety provoking, your body is just going through this moment, okay? So if this is you, let me tell you what's actually going on. It is your stomach. Now, anatomically, your stomach is just below your rib cage on the left. Right above your stomach, which is a bag of acid, right above it is a muscle called your diaphragm. It's on both sides. It's a dome-shaped muscle, but we're talking about the left side right now because that's where your stomach is. Now, when your stomach is compressed, And you might have acid reflux that you know of. You might not feel it. 50% of people who suffer from reflux have what's called silent reflux. It's the difference between acid gushing up your esophagus, which sometimes people are spitting out the acid, they feel tremendous burn, or that's obvious acid reflux. And then there's silent reflux where the acid is just kind of creeping up the esophagus. It's still moving up the esophagus, which it shouldn't, but it's moving slowly, and it's then called silent. And that's 50% of sufferers. So you've got a 50-50 chance of this being you. So, but what's happening is that the stomach is compressing. Now your stomach is connected from your mouth via the long tube called your esophagus. And as that stomach compresses, for reasons we'll go into, it gets pushed up. So what does it run into? What's right above it? The diaphragm. So now your diaphragm spasms. So instead of moving that nice 1 to 5 inches, nice and effortlessly, such that you breathe and you're not thinking about it, it just, the oxygen comes. Now the diaphragm has gotten spasmed, and it's like, it's not moving very well. And you feel that, because this is your body, and you know what's normal. And you feel that, I'm not getting enough air, okay? So what we do, we call this hiatal hernia syndrome, because it's a cascade of symptoms that are all related. Now, just to finish the story of anatomy, we've got the stomach, right above it is the diaphragm, right above that is the heart. So sometimes people also, because the stomach gets elevated and the diaphragm gets elevated, they both get in the way of the heart, and the heart starts palpitating. So it's a very similar story, because again, you've rushed to that ER, or you've rushed to your cardiologist to be told, just like your lungs, that your heart is fine. You know, that's nice, but it's beating out of my chest pretty well, which is freaking me out, okay? And so you can get into this dilemma, and I meet hundreds of people week after week that are in this dilemma of, I just spoke to a woman yesterday, and she clearly has this problem. And, you know, she said, mentally I'm starting to just doubt myself, you know? Very smart woman, she's a professional, she's a mom. She goes, I have a good life, you know? I have 2 beautiful children. I have a very loving family. I have a great husband. She goes, I love my job. And she goes, mentally, I'm just not the same, because too many people are telling me you're fine. She goes, when I feel terrible. So if this is you, I want you to know that there is a reason underlying this. The name of my clinic is Root Cause Medical Clinic. So we're very good at getting to that underlying reason beneath symptoms. But this shortness of breath is very scary, because I tell my patients all the time, like, we can live apparently a month without food and a week without water. But how long do you live without breathing? Not very long. So of course your body is going to get pretty stressed. It's going to secrete a lot of stress hormones. You're going to feel very anxious when this phenomena is occurring. So not only do you have a feeling of, I can't get enough air, but then you feel really anxious. I spoke to a young man yesterday, and he goes, I feel like I'm dying. You know, this just comes upon me, and I just feel like I'm going to die. And he goes, it's happened so often. He goes, I know I'm not going to die, but every single time I'm convinced I'm going to die, because the anxiety is so overwhelming. So again, if this is you, please know there is a reason. Your body has a reason it's creating this problem. It's not in your head, it's actually in your gut, and we know what to do about it, and we'd be delighted to help. So please reach out. I'm Dr. Vikki Petersen.